Good evening, everyone, and welcome to this very important session organized by Medanta Super Specialty Hospital, Noida. I am Dr. Belal bin Asaf. I am a senior consultant and director of thoracic surgery at Medanta Super Specialty, Noida. And we are today addressing a very concerning issue for all those who are living in Delhi NCR and across India. Now, the topic today is, can air pollution cause lung cancer? And if yes, what can we do about it? We all see the smog, we check the AQI daily, but very few people know what this actually is doing inside our lungs to our children, to adults, and the elderly. Today, I'm joined by two distinguished colleagues, Dr. Manu Madan, a senior pulmonologist, and Dr. Ashutosh Jaiswal, a medical oncologist who are both working with me at Medanta Super Specialty Hospital, Noida. And together, we will break down the science, the risks, symptoms, and the rise of lung cancer in non-smokers and how early detection can save lives. Our goal is very simple. Awareness is very important for these things because unless people are aware, they won't be able to take actions. And for diagnosis of lung cancer and to have an adequate, good outcome, it is very important that people be aware of how to diagnose it early so that it is still treatable and often curable. So let me briefly introduce our experts, Dr. Manu Madan. Thank you so much for joining us. He's a DM in pulmonary medicine from All India Institute of Medical Sciences, New Delhi, and a senior pulmonologist and lead at Medanta Hospital, Noida. And he sees firsthand how pollution worsens respiratory health. So once again, welcome, Dr. Manu. Thank you for joining us today. Dr. Ashutosh Jaiswal, he's a consultant medical oncologist, again in our hospital at Medanta Noida. And he is regularly managing lung cancer patients and he understands the intricacies of oncology, which means what molecular damage, how cancers are formed, and therefore he will be a very useful addition in helping us understand how air pollution is going to be a danger for all of us. So thank you for both for being here, and let's begin our session. So, before we talk about the cancer, let's understand something very basic. What exactly is in the air that we breathe during high pollution periods, and why is it harmful? Dr. Manu, we've been hearing about PM 2.5, PM 10, nitrogen oxide, sulfur oxide, ozone, all these kind of pollutants that are present in the air. Which of these pollutants are very dangerous and why particularly PM 2.5 is considered so dangerous for our lungs and how does it affect our lungs?
Thank you for introducing me. Amongst all of them are actually harmful for our body. That is why we have put them and clustered them into AQI sampling. We consider PM 2.5 as very significant for us because India is a pretty dusty country. That is why these PMs become very important. For the people who do not know what is a PM 2.5, PM stands for particulate matter. That means that is not gaseous. It's not a gaseous thing. It is a particulate matter. And the 2.5 or 10, which is placed after the PM, means the size of it. So 2.5 micron is the size of it, and 10 micron is the size of PM10. To compare it with the size of a hair, our hair is around 70 micrometers. So it is 1/7 of the size PM10, and PM2.5 is even smaller. So the larger the molecule, higher the chances that it will be stopped by the nose hairs, the nares, and the pharynx, the windpipe or the neck or the throat, you can say. So problem with the smaller molecules is they are able to go deep inside the lungs, through the nose, through the throat, and ultimately the lungs. Now we have few defense mechanisms in the body to stop these things from going inside. As I talked about nose, so whenever a dust particle or anything tries to enter your body tries to stop it. What can body do? Apart from the anatomical things like the hair in the nose, the mucus, it has a few mechanisms like sneezing. Why do we sneeze? We sneeze to expel the foreign body outside. There is nasal blockage that can happen when you have any foreign body trying to enter your body. There can be excess mucus produced, which will try to stop the dust particle from going inside. All these are defense mechanisms. So, despite that, if the dust particle enters your throat and enters the windpipe, then body again tries to stop it there as well. So, this big is the windpipe. For people who do not know or not from the medical background, this big is the windpipe. So, when this thing enters the windpipe, we have small hairs called cilia in the windpipe as well. We try to stop it. But if despite that it is going through the windpipe inside, windpipe will shrink. This is called constriction. So this constriction is happening to stop it from going inside. When it constricts, it causes symptoms like shortness of breath, it will cause coughing, it will cause chest discomfort, it might cause wheezing sound. These are all symptoms when this particle enters your chest. And what happens is many of the times that despite this, because of the small size of this molecule, this narrowing is not going to stop it. It further traverses down into our lungs and gets deposited in the lung. In lung also we have few defense mechanisms, few cells like macrophages, we tend to engulf this foreign body and try to move it. But when they are living in such kind of pollution, they get overwhelmed. They're not able to clean it completely. As a result, it gets deposited and continues to worsen us even when the season is over. So it's not a short-lasting thing; it's a long-lasting effect on the body. So that is why this becomes very important, the particle matter. And this PM2.5 has the ability to penetrate the blood as well. Since it's small, it goes into the alveoli in the lungs and from there into the blood. Even smaller molecules like PM0.1, which are not detected much, they tend to go into the body further. And once it reaches the blood, and it causes symptoms to the whole body. So that is why it becomes very dangerous since it has impact on the whole body.
Very nicely explained, Dr. Manu. So if I can summarize this, the PM2.5, because of its size, it's so small that it can, bypass all the barrier mechanisms that we have to protect ourselves, and then it goes into the blood. And once it goes into the blood, blood goes to all organs of the body, and therefore it will affect not only the lungs but other organs of the body as well. So I think that brings us explain with us what is the different particles, particulate matter, and how they affect our body. Now, I want to show you a small picture, Dr. Manu, because this is exactly what we are seeing and my daily reality as a thoracic surgeon. So I'll just quickly share the screen and just give me a moment here. So, Dr. Manu, this is a very, very stark image. I hope you can see the image that I'm showing right now.
Absolutely.
So, this is the healthy pink lung, the way the God has intended to be. These are the lungs that we are born with, and they are supposed to be like that. And me being a thoracoscopic surgeon, I see the lungs from the inside as a part of my daily routine. And these are the healthy pink lungs, which very occasionally do you find for people who are coming from other areas which are not so polluted. This is a lung of an individual who is a non-smoker. This is a 40-year-old non-smoker who we operated for some lung problems. And you can see the amount of black mottling that is there. And this is probably because he's a non-smoker, we can attribute this to air pollution. And if over and above this, somebody is smoking, this is what happens to those lungs. So these are the typical lungs from a Delhi of a person who had smoked. And you can see the large amount of black deposits. Unfortunately, as you rightly explained, these deposits, these are toxic deposits that remain inside the lung permanently, and they cannot be washed away or removed. So it's a very, very serious problem we are seeing on a daily basis. I thought I'd show these pictures for general public to understand what is actually being, what is the damage that is being done by air pollution to our body. So we move on to our So the next question I'd like to ask Dr. Ashutosh there. Dr. Ashutosh, our topic suggests that air pollution is caused by lung cancer can be caused by air pollution. Is that true?
Thank you, sir. Yes, sir. The answer is very clear and evidence-based that air pollution can and does cause lung cancer. In 2013, International Association of Cancer Research, they classified air pollution as Group 1 carcinogen. And later on, they added PM2.5 as well to the list as a Group 1 carcinogen. So, which means that there is sufficient evidence that air pollution and PM2.5 causes lung cancer. So there is no doubt about it. So how does this translate into lung cancer? So as Dr. Madan told, PM2.5 are very small particulate size, 2.5 microns. and they are less than 1/30th of the size of a hair. So
Yeah.
they have tendency to reach to the distal part of our respiratory system, and what they contain? They contain different kind of hydrocarbons, benzenes, heavy metals, which are all carcinogen. So, what does these do? They reach to the distal part of the respiratory system, and there they cause chronic inflammation. And because of this chronic inflammation, our lung they come under severe oxidative stress, which leads to different kind of different DNA damage. And in simple terms, these DNA damage they switch on the cancer-causing gene mutations and switch off the protective gene mutations. So, which leads to cancer formation. Uh, and we have seen in our daily practice now that, and even in worldwide data, 15 to 10 to 15%, 20% patients of the lung cancer are thought to be due to air pollution. Various studies from our country as well have shown that approximately 25 to 30% of our patients from in the lung cancer clinic, they are non-smokers. And the non-smokers, they are young. In fact, it is routine now to see patient in their 40s, in sometimes in their 30s as well. Patients come to us with lung cancer problem. So, yes, the answer to the question is, can air pollution cause? Yes, definitely it can cause cancer, and it is happening right now in front in our clinics, and we see it almost daily.
It's very nicely explained, Dr. Manu, and that's exactly what we have been seeing. We as a group have been involved in treatment of lung cancer for over 2 decades now. And what we have seen in our own practice is three remarkable changes that means, and I think you guys will, sort of echo my thought process in that. So what we've seen is that, initially lung cancer used to present in 90% in smokers. But nowadays, many patients, at least because in the last thesis that we did with one of our students about lung cancer, in that series, although it was a representative sample for a small sample, but 40% of our patients, nearly 40% of our patients were non-smokers who had never touched cigarette in their lives. So that was a very alarming change that we have observed. So from 90% smokers to nearly 40% non-smokers that we have seen. Another change that we've seen is the age group has gone down by almost a decade. So, in fact, you very rightly pointed out, we've seen patients who are coming with lung cancer in their early 30s, and in fact, even in 20s. The youngest that we have operated on was a 28-year-old gentleman with lung cancer, and that is really alarming. And people should start really thinking about these things. And the other change that I've noticed, that we have noticed, is that more females are now coming up with lung cancers. Earlier, it was mostly a male predominant disease. But nowadays, many female patients are also coming up with lung cancer. And this explains probably that smoking alone is not the causative factor. There are several other environmental factors that are playing along with the genetics and family history and a lot of stuff, which are leading to development of cancer in these non-smoker group. So thank you very much for clarifying that. Dr. Manu, I'll head back to you. You are a pulmonologist. Your how is your OPD attendance these days in the last few weeks when this or month where the pollution has increased dramatically? What are the symptoms that you're seeing in your patients? Are your patients requiring more medications? What is the severity of their presentation that you are having?
Yes, our OPDs do increase after Diwali. That is probably every year. That is like an annual health emergency. That we tend to see a lot of more patients after Diwali season. Uh, we have patients who have burning of eyes. Before that, I'd like to explain what kind of symptoms come early and what kind of symptoms come late. So in our
Yes.
body, there are different types of skin mechanisms and defense mechanisms as we have talked about. Skin is one of them. Skin is a resilient tissue. So you'll have problems related to skin slightly later. But whenever a foreign body enters the mucosa, which is the inner lining of our nose, maybe, or mouth, or the organs, whenever it reaches that part, we'll have instant patients coming to us for the complaints. So, for example, if there is any smoke or pollution increase in the environment, we have patients coming with burning eyes. We have patients coming in with nasal symptoms because the nasal mucosa is very fragile. You have symptoms of cold. We have patients who come with post-viral bronchitis kind of symptoms. They have a feeling of asthma. They have short duration of fever, maybe. So these kind of symptoms do increase in our practice at this point of time. These are for a group of patients who were not symptomatic or not having any disease prior to this. So the younger population tends to have more of chest congestion and wheezing sound and a cold. While the people who are elderly or who have at higher risk for underlying heart and lung disease, they tend to have worsening of the underlying condition. So you tend to see more heart failure, you tend to see increased strokes also at this point of time in CVD patients. Uh, if there is a COPD patient or known asthmatic patient, their exacerbation might increase. They might require hospitalization at this point of time. So, depending upon what the underlying condition is, the worsening can be there. Otherwise, in general, we do have respiratory illnesses worsening, leading to hospitalizations at this point of time.
Okay, so basically, what you're saying is that there are two groups of patients. One who never had any respiratory complaints and were actually fit individuals. And then, because of the pollution, their respiratory tract is responding and they are developing symptoms, as you're seeing, and we are seeing in our OPDs, and many of our actually close family friends and family members as well. When they go out, they are complaining of this wheezing, chest congestion, and dry cough. Uh, Very rightly pointed out. But do these patients actually, the ones who are the other group that you talked about, are the patients who are already having or suffering from cardiac or respiratory illnesses, and they tend to, sort of increase. There is an increase in their symptomatology. So, do these patients actually are become sick enough to actually require hospitalization, as you pointed out?
Absolutely. So there are studies which have shown that during the peak pollution time, there are increased hospitalization of patients with underlying disease. There are increased incidences of heart attacks and strokes at this point of time, and there is increased risk of even death being reported in many studies at this point of time because of the pollution per se.
Now, Dr. Manu, as a surgeon in my OPDs, and I'm sure lung cancer patient comes to us, majority of these patients are, advanced stages. Those are nearly 80 to 85% patients that come to us are not early stage lung cancers. They are either advanced, locally advanced, or advanced stage lung cancers. And unfortunately, the outcome at these stages are not as good as, early stages lung cancer. So why you as a pulmonologist see these patients who are presenting with respiratory symptoms? Why do you think there is a delay in diagnosing early stage lung cancer and most patients come at advanced stage?
One of the reasons is that as Indians, we tend to take things very lightly. Uh, Chronic cough, persistent cough is something which happens very frequently to many individuals and they don't take it very seriously. But keeping that in mind, if your cough is prolonged more than 2 weeks, then it needs evaluation. If there's danger signs like chest pain is associated, there is bleeding when there is cough, there is increased shortness of breath, which is gradually progressing. These are signs that it needs evaluation. So most of our patients tend to forego these symptoms. They also have loss of weight, loss of appetite. This is attributed to other things like change in diet, change in place. That they don't attribute that this can be illness per se. That is why we tend to see patients which come in very later stages. And that is the reason, in general, our population, which probably comes, Dr. Ashutosh might agree, tends to come in stage 2, stage 3 at least. It's rare, probably, we had a stage 1 disease in our OPDs.
Yeah, Dr. Ashutosh, would you like to add something to it?
Yes, sir. Definitely. Lot of the lung cancer which develops, the people are not aware of the symptoms. They take it very lightly, especially persistent cough and sometimes even hemoptysis. They take it very lightly, blood in their sputum and all those things. So we need to make them aware that early we get earlier the diagnosis is done, the better will be there for them. So that means that is the crux, and as a medical oncologist, I can tell you the earlier the patient comes to us, the better is for them. Stage 1 lung cancer, the survival can reach up to even 90%, 5-year
Yes.
survival. Yeah. And as we go down the line, so the disease has spread to the other part of the body. So their survival is very dismal. Even the curative option is out of the our side, and we just unfortunately we just buy time there. Survival is less than 10%, 8% in those cases. So yeah, definitely we have to take the symptoms, respiratory symptom, especially persistent cough, loss of weight associated with the hemoptysis, blood in the sputum, all those things. So,
So
so
I
we
think
can detect
uh,
it early.
so So what I think is, one of the reasons that people with lung cancer present late is because truly non-specific nature of the symptoms. And as Dr. Manu pointed out, many of these symptoms are ignored as, normal illnesses that most of the patients face. So everybody at some point of their life will be having some cough, cold, persistent cough, and a little bit of these symptoms, and they will not actually relate this to being lung cancer. So it is very important to understand that when these symptoms are persistent, that is when you should at least seek a consultation from a pulmonologist, at least that you get yourself examined and rule out that you're not having any sinister ridge. So what are those symptoms? Just for the sake of completeness, I'll repeat those symptoms. So if there is a patient who has persistent cough which is lasting for more than 3 weeks, or there is a change or a new character of cough, so we see many members in our family who have been old, had been smokers, they have coughs in the regular basis, but if there is a change in the character of cough and that has persisted for more than 2 weeks, or even if it is a new onset cough which has persisted for more than 2 to 3 weeks, I think it's time that you should visit your respiratory physician, because they will be able to, sort of analyze and rule out why this cause is there. Another very important symptom, Dr. Manu, is blood in sputum. Blood in sputum is almost never a normal run of the mill symptom, and therefore has to be taken very seriously. Now, I've seen patients coming to me with blood in sputum saying, डॉक्टर साहब एक बार खांसी में सुबह करते हुए ब्लड आ गया. This is a very common kind of presentation. But what is your take on this? How should people respond to blood in sputum?
Blood in sputum is a great symptom. So whenever someone has hemoptysis, we do not take it lightly as a clinician. We tend to evaluate that hemoptysis. It can range from a normal post-viral bronchitis to tuberculosis to cancers, two of the deadliest diseases which can spread to the body and cripple you. So if whenever there is any blood in your sputum, when you're coughing, I think you should come visit the doctor at once and get it evaluated. Many times, doctor, when they come to the doctor, we give prescribe them some medication like tranexamic acid. Hemoptysis will stop, the bleeding will stop, and they will not follow up. They let it grow inside their body, and when they come, they will be flourished. The disease is spread everywhere in the body, and that is a time where we have to say that probably we are late in probably completely curing the cancer that is there. And even if it was TB, it might have spread to the other organs, which can be fatal.
Right. So the other important thing is, apart from blood in sputum, the blood in sputum, of course, should never be ignored. You should always visit a respiratory physician and get yourself evaluated. Another is, as you had pointed out, unintentional weight loss. Now, the key word here is unintentional, because you're not trying to lose weight and then you're losing appetite and weight. That is again a symptom. If it is persisting beyond 2 to 3 weeks or a month, you should consider getting yourself evaluated by a doctor, because you have to find out why you're having weight loss. The other important sign, I as a surgeon have seen that some patients present with focal chest pain. Nothing was there. There's just a focal dull ache that is there on the chest. Again, it should not be ignored. If it is persisting despite some initial medications, you should visit a doctor. And of course, beyond that, any of these symptoms, when they are persisting or anything unusual, you should always visit a doctor. In fact, shortness of breath. For example, a patient who's been walking 4 to 5 kilometers every day and then suddenly starts to have breathlessness at, let's say, 2 kilometers, 1 kilometer, that's something not normal. There has to be something wrong. Whether it is cancer or not, that needs to be evaluated by a respiratory physician, and then they should visit a respiratory physician. So now, Dr. Manu, again, so when we have to identify lung cancer early, How do you recommend we do that? What is the recommendation for trying to evaluate these patients and detect them early so that the cancer can be detected at a very early stage and cured?
One is, first of all, if you want to pick up the cancers early, one is definitely the awareness, which has to be at the population community level. The other is definitely what we clinicians do. There are specific criteria which we follow as per the American oncology guidelines. They recommend if you are more than 50 years of age, you have been a smoker, then we can do a low dose CT scan annually till the age of probably till 80, 81 years of age to diagnose if there is any incidental finding which can be the onset of your cancer. And so this is the same criteria we use in our OPD as well. If you are a smoker more than 50 years of age, we advise you for low dose CT scan for screening of lung cancers.
Yeah, very nice. So low dose CT scan is a specific kind of CT scan protocol wherein a very low dose of radiation is used to screen the individuals if they have any abnormal lung nodule which could be cancerous. So that is the idea of lung cancer low dose screening. And as you had rightly explained, that these are the criteria which are established criteria. Now, when you look at these established criteria, Dr. Manu, would you expand these criteria in certain specific situations to include people do not truly classify into this particular criteria, like the age group of 50 to 80s, 20 pack years of cigarette smoking? If these are not there, do you still recommend low dose CT screening for a particular subset of patients?
Yes, we do recommend at times when you have significant risk factors like occupational hazards of radon exposure, or there are any occupational hazards which are there, which can be inciting agent for cancer. We can use these factors. And the problem is that most of these guidelines are coming from USA or the places where there is not significant amount of pollution.
Very true.
So when we talk about smoking, it's only smoke which is the hazardous thing in the environment. But when we talk about in our environment, when we are facing 500 AQI daily, that amounts to roughly 20-25 cigarettes a day.
Yeah.
So in true sense, we are also smokers. So
Absolutely,
that is why
absolutely.
these are the areas where we have to twerk the criteria a bit at times. But
Yeah.
in general, we tend to follow the guidelines, but we do work the criteria depending upon the patient.
So the fact about non-smokers being smokers is actually now very proven. So there's a calculation, very simple calculation. So if you take the PM 2.5 and divide it by 22, that is the roughly the amount of cigarette that the numbers of cigarette that you're smoking per day. So I did I did a back analysis. I did a Google search for PM 2.5 average in the Delhi region over the last year, and it came out as 104. Now 104 meant we are smoking 5 cigarettes every day, and you multiply that by 365 days, that comes close to 1,700 cigarettes a year. So I mean, truly speaking, nobody is a non-smoker in our country, and therefore we need to sort of change these criteria and be more liberal in identifying and doing low dose CT scan because of the importance of early detection of lung cancer. Now, my question to Dr. Ashutosh is, Dr. Ashutosh, why is early detection so important? Can you give us some idea about, you already told some statistics about, the survival advantage in stage 1 and stage 2 versus stage 3 and stage 4?
As a medical oncologist, the stage at which we diagnose lung cancer decides whether patient goes home cured or whether we are just buying time for him. So this is the basic tenet of it. Stage 1 lung cancer, as I earlier told as well, that survival can be up to 90% with just surgery only or some additional treatment along with surgery. Stage 2, as the stage progresses, so the survival continues to drop. In 2020, stage 2, 50 to 60%, and in stage 3, it goes to 20-30%. And stage 4, it becomes uncurable, where survival is less than 10% for 5 years. So, this is the basic thing. I mean, we have to diagnose it early, and screening forms a major support for it. Today, we have very incredible therapies for lung cancer in the form of targeted therapies, where we just give a pill in some and patient just pops a pill and his lung cancer is controlled, or patient goes in remission. And we have immunotherapy, so which can give patient long-term remission, even in late stages as well. But the thing is, all these treatment, although they have increased the survival in stage 4, they work better in if the disease is limited. Even targeted therapies or immunotherapies, the disease load is low, then they work better as if the patient is in stage 4. So, from therapy point of view as well, if we get the patient in stage 1 or 2, so is better for patient outcome. So, as sir told, screening with low dose CT scan becomes very, very important, especially in the high AQI environment we are living in. And as I told you earlier, like that that the tumor size, if it is small, then we can cure it by such simple thoracoscopic surgery, as you will tell
Yes,
to
yes.
us. Yeah. So that is it. Low dose CT scan is just a 5-minute procedure. Very low dose of radiation is given to the patient, and as I also told that we have to think about expanding our criteria for offering these screening tests. So our patients are becoming younger, and our patients are becoming non-smokers are having cancers. 30-40% of OPD is non-cancer, non-smoker and young patients. So we have to think about screening very seriously. So
Yeah.
to give the better outcome.
So, from a surgeon's perspective, when you talk about localized or early stage lung cancer, it becomes very important for us as well because, for localized disease, surgery appears to be the best treatment option for early stages. And earlier, these diseases required, open surgeries and big incisions, which were quite painful and significant morbidity was associated with it. But now, with the advancement of video-assisted thoracic surgery and robotic thoracic surgery at Medanta, nearly 80 to 90% of our lung cancers we operate by either keyhole incisions using thoracoscopic or video assisted thoracic surgery, and even the most advanced like robotic thoracic surgery, where 3 or 4 8 incisions are just required to remove the lung. Now, these obviously improve the quality of life. So, when you're cutting open the chest, you're cutting through the skin, muscles, and the layers of tissue, you're spreading open the ribs. If you can avoid all that trauma and do the same surgery without the need of that much of trauma, then of course the patient's experience in terms of post-operative complications, it's in terms of the comfort and in terms of lack of pain after the surgery becomes very important, and hence the quality of life improves. But all this is only possible in patients who have been detected early and who have been detected at a stage where we can offer minimal invasive thoracic surgery because it offers faster recovery, better lung function preservation, and very small scars. So, very rightly said, we want to detect the cancer early. And the other thing that you mentioned is very important for me to point out. The drop in the survival rates from stage 1 and 2 to stage 3. So, when we're talking about stage 1, it's nearly 80 to 90% of if you've treated it correctly. Then in stage 2, it drops down to 65, 70. But as we hit the stage 3, straight away drops to 30%. And that's a huge jump. That is why early stage detection is very, very important. And one of the impediments that I've seen, Dr. Manu, is these symptoms being correlated with tuberculosis. And patients thinking that, and even some doctors in the peripheral area treating a lung patch or a blood in sputum as tuberculosis. What is your take on that? What is your take on that, Dr. Manu?
Absolutely true, especially in peripheries where they don't have any diagnostic facilities. They do not tend to refer the patient, they tend to treat them empirically without any evidence. They tend to treat the patient with TB treatment because TB is a very common disease for sure. But everything is not TB. Many a times,
Yeah.
because they are having these overlapping symptoms, they are treated for TB, they land up from a treatable lung cancer to becoming a untreatable lung cancer. So that is pretty prevalent in our country. And I think of recent, at least in Delhi NCR, there has been a change in practice towards getting an evidence for whatever disease you're treating and not treating it empirically. And we follow that as well. And we want evidence before we treat anything. And that should be the practice everywhere.
Yeah, very rightly said. TB, it has to be diagnosed based on certain criteria that the government and Minister of Health and everybody has laid down those criteria, how you, sort of label a patient as having tuberculosis. And more important, as you very rightly said, you have to have some evidence regarding that. So to gain that evidence either by bronchoscopy or by tissue biopsy. Now, this brings us to the concept of biopsy, Dr. Ashutosh. Many patients fear biopsy. They feel that the cancer will spread because of the biopsy, if it is the cancer. What is your take on that? Is this a myth or this is a reality, and how should patients respond to it?
This is a complete myth. As far as we have to, as Dr. Madan said, we have to be completely sure before treating any condition, whether it is tuberculosis or whether it is cancer or anything else. So biopsy helps us in getting the tissue sample and helps us in diagnosing the cancer and the type of cancer. Even as I told you that we have lot of targeted therapies these days. So biopsy forms a part of it, and we get to do a lot of molecular tests over it, so we can give the best treatment to the patient available. Without biopsy, this is not possible, and it is a myth that biopsy can lead to dissemination of the tumor. Already, we see the patient who don't get treated, the disease tend to get disseminated itself. So we have to make people aware that biopsy is the part of solution. It doesn't causes anything detrimental to the patient.
Very rightly said. The tissue diagnosis and finding out and taking a small core of tissue from that lesion, if it is seen on the CT, will probably not lead to will not lead to any increase in the cancer. In fact, it's very essential to know exactly what kind of cancer it is, and then do further studies on it to know the genetic mutations, to know the molecular markers, so that you as medical oncologists can then make a tailor made therapy for that particular cancer. So it's extremely important to get this message across that if there is anybody who's having a lung lesion, a lung nodule, which can lead to which can be a cancer, getting a biopsy, if the doctor has advised it, is not going to be harmful. In fact, it is going to give us the diagnosis and make the treatment possible. Thank you, Dr. Asher, for that answer. Dr. Manu, considering we breathe nearly 25,000 times daily, each one of us unconsciously is breathing 25,000. We don't even feel that. And we're taking about 10,000 liters of air. And if you look at the current quality of air, where the AQI is 300 and 400 and the PM 2.5 level, even within my room last night was around 140. How do we protect ourselves? What should we do to protect ourselves from such rampant air pollution?
It's a pretty sorry state to have. The thing is, two things have to be done at the government level and community level to actually work on it. And one is at the
Yeah.
personal level, which we can talk about it here. First and foremost thing is wearing masks at all times. By all times, I mean when you're outdoors. Uh, there are three types of masks available in the market. If you have seen the cloth one, the cotton one, which has the efficacy of stopping about 30 to 40% of the pollutants. In the surgical mask, as doctors what you wear, the logo one, blue and white one, that stops around 50 to 60%. While the N95, as the name suggests, the 95, the 95 means that it has the ability to stop 95% of the particulate matter. So, by inherent property of itself, it is the strongest mask. But it also has some problems associated with it.
Yeah.
A mask which you wear on your face is stopping the dust particle from coming from outside to inside. Is also not allowing the carbon dioxide which you have exhaled. That also remains in the mask and you tend to inhale back inside. So this was a study since mask became a thing during COVID, and we also had to do long duty hours. I did a study on myself. Uh, I took my sample before and after my duty hours of wearing this N95. What I realized was my carbon dioxide levels had significantly increased. My pH acid level was significantly low, which we published this also in an international journal later. My pH was 7.25, which was in terms of medical analysis very severe, and patient requires IC. So this was my condition after wearing the mask for 3 to 4 hours. And this is when I realized and looked up the literature. The literature says that this can happen. So for my patients, I usually say you have to wear the mask for sure. But if you want to wear it for prolonged periods, after an hour, probably give a break to surgical mask for some time. Let
Yeah.
it be normalized, then switch back to N95 later and alternate these masks. If you want to wear for short duration of time, wear N95 alone, that is good enough, and rather the best mask. Other things what you can do is, since this N95 is also 95% efficacious, still 5% is going inside your body, despite wearing it at all times, which is not possible. So I recommend my patients they do frequently do steam inhalation and flying gargles, and it's water only, so there's no harm doing steam inhalation and flying gargles multiple times a day. If you are at high risk, like if you are having underlying heart and lung disease, you are an elderly or very young in age, then I usually recommend try going outdoors. Check the AQI daily. Try going outdoors. Avoid going outdoors. If you have to go for some reason which is urgent, if you can wait, wait till afternoon. Because in morning and evening hours, the pollution levels are slightly higher, closer to the ground. And when you do that, when you go outside, you tend to breathe more. Problem is, the elderlies, they have their clubs in their societies. They tend to meet their friends in the morning. They have to go
Yeah.
out. They'll talk to them. They'll feel lonely otherwise that they are doing sitting at home. So for them, I usually tell them, do exercise. Do exercise at home. Don't go outside. Because the more you exercise outdoors, it increases your respiratory rate. Your breathing frequency increases. The faster you breathe, more toxic in air you make. Call your friends home, sit together, have a tea, do exercise separately. So this is what I recommend to my patients. Otherwise, apart from that, in general, in total, what you can do is increase your hydrations. That will help you. Good sleep hygiene tends to help your body's immunity. These are the things you can do. And there are a couple of other things which people talk about pretty frequently. One is the air purifying plant, which can definitely help you a bit, and the air purifiers. Again, for me, that's a bit of contentious thing. Reason being that I'll give you an example. Do you bathe with cold water during winters? Few people might say yes, and they are okay with it. Uh, but the same people, if you ask them to bathe with warm water and ask them to bathe with cold water again immediately after it, so how will it feel? जिसे हम हिंदी में बोलते हैं गर्म सर्द हो गया. Something of that sort can happen with air purifiers. There are studies which show that it decreases asthma and allergies and inflammation, but provided use it for continuous duration, longer periods. You use the air for 3 to 4 hours. Do frequent change of environment is there. You move from inside of your house to outside of your house very frequently. So this might even have a detrimental effect as well. If you can ensure that you can stay in the air purifying room for sufficient duration of time, or you can ensure that the places you go, your office, your car, you also have your air purifiers there as well, then these might be beneficial. But 3 to 4 hours a day is not going to help you, and frequent change of environment is not going to help. So usually I recommend for people who are going to stay indoors, elderlies with illnesses who stay indoors only is very helpful. So people who have only nocturnal symptoms only at night, they are fine throughout the day. They can also use it while sleeping at home. For other group of patients, you can try it, but if you feel any discomfort or rather worsening, then avoid. So these are usually my precautions I advise to my patients.
I think just to reiterate a couple of things which you pointed out, that N95 mask is a closed system when your carbon dioxide levels can actually increase. Some people have seen that use the ones with valve. I believe that that might help in reducing that symptoms. In COVID, we don't used to advise the valve ones because it would allow others to be exposed. But in non-COVID days, you can use the valve N95 mask so that it increases your expulsion of carbon dioxide. The other very important thing that you pointed out is about air purifiers. Air purifiers, they've got so many queries from neighbors, from company members and everyone that what is your take on air purifiers? And we being, sort of 4 years of lung health, being a thoracic surgeon, you are a pulmonologist and Dr. Ashutosh, a medical oncologist. We know that, what you're offering here, the people should realize is a very personal solution for a global problem. As you very rightly pointed out, once you're talking about air purifier, it has to be air purifier where you can have purified air most of the time. So your house needs to be completely sealed. The air purifier needs to be of the adequate capacity, and it needs to be run on a continuous mode. When you're in a room and when you walk out of the room, as you rightly said, in the room the air quality may be better, but as soon as you walk out of the room or you walk out of your house, you are exposed to the same quantity of air pollutant as everybody else is. So yes, I believe that it is a personal solution for patients who are at risk, and then for persons who remain indoor all the time. But it's not really a global solution, and we need to sort of raise awareness regarding this. That instead of working on these very local solutions, we need to have more solutions so that the government can work and develop and improve the air quality, and that is actually the long-term solution for this problem. And of course, those people who are smoking still, they should stop smoking completely, because already, as I pointed out, that none of us are non-smokers who are living in this highly polluted areas. So that brings us to the question. We'll take a few questions from the audience. I believe there are certain questions there, and I'll look at the questions and I'll ask the relevant questions from Dr. Manu or Ashutosh. So, so there is a question: who is at higher risk for lung cancer from air pollution? Dr. Ashutosh, would you like to take that question?
Yeah. So elderly people having history of smoking, people who have occupational exposures, these patients, the people
So,
have
Dr.
a
Manu,
history of.
can you just explain the occupational exposure that we are talking about so that people understand what kind of occupational exposure leads to lung cancer?
So, me,
Yes, yes,
yeah.
Dr. Ashu.
So, professional exposure like asbestos, people who have exposure to asbestos, like certain industry, who have tendency to expose people to the more asbestos, like shipbuilding industry and all the these infrastructure building industry. These expose patient to asbestos, so they have more chances of getting lung cancer. So yes, these are the patients who are on additional risk of getting cancer apart from the general population.
So essentially, everybody who is getting exposed to this polluted air is at risk. But there are certain individuals who will be at higher risk. For example, those who have already smoked, those who have some chronic lung diseases, those who have occupational exposure, as you rightly pointed out, asbestos exposure, or those who are on the roads all the time. They may have a higher exposure, and of course, the ones who with family history or history of other kind of cancers are also at relatively higher risk of developing lung cancer from air pollution. Dr. Manu, can lifestyle changes reduce the risk of lung cancer?
Absolutely. There are multiple risk factors associated with lung cancer. Dr. Ashutosh would be helping us a bit here. For example, poor diet is a risk factor. You need antioxidants in a diet which can be significant. You want pure air in your environment. That is why part of lifestyle. Any amount of stress and sleep also help is also contributing to a lot of immunogenic mechanisms in the body. So yes, there are a lot of lifestyle changes, including smoking and alcohol, which definitely attribute to cancers in the body. So yeah, a lot of things are required when you try to negotiate lung cancer.
Right. So healthy lifestyle changes not only improves the cardiovascular health and your muscle fitness. A healthy lifestyle also means avoidance of all those toxic materials. So currently the food that we are eating outside, particularly the outside food and the junk food, all these contain a lot of toxic materials which are not really controlled well, and therefore avoiding these can improve the general health as well as the overall risk of cancers. And as you very rightly pointed out, quitting smoking is very, very important, and maintaining a healthy lifestyle in terms of good diet, rich in antioxidants, a lot of fruits, a lot of green leafy vegetables. These are the things that may help reduce the risk of lung cancer. There is a question. There is a very specific question. I think Dr. Manu would be able to answer that question. Somebody wants to know what tests should be done if they are having persistent cough.
If there's persistent cough, there can be multiple mechanisms. So as we discussed initially, cough is a very generalized symptom. It is a non-specific symptom where it can range from seasonal cough or a viral to TB or even cancer. So just Cough per se, we require basic tests initially, which we includes a chest X-ray, we require PFT, we require CBC and an IgE test. This is what we usually do. So the patient has nasal symptoms, we go for a CT scan of PNS as well. The basic test we do for the patient who have just cough.
Okay. So any patient who has cough first needs to come to a doctor, and there he will physically, sort of examine the patient, and then based on what he feels, he will, certain advise certain tests. And the common tests that include are the chest X-ray that you rightly pointed out, and the pulmonary function test is where you test the functional capacity of the lung. And if then you feel that there is something more required, you offer some blood tests, and if I know, and then certain CT scan if further evaluation is required. So that is what is required for patients who are having persistent cough. And I believe that the message that should go across is go and meet your doctor. Let them decide what is the best test to do and sort out your cough, because they will do what is needful for your persistent cough. Then there is another question. I think again, Dr. Manu, you being a pulmonologist, you will be taking this question. हेल्दी लंग्स अगर हैं तो पीएफटी टेस्ट में लेवल कितना होगा एंड आई विल ऐड हाउ इज देयर अ वे a general population general public can do a self test at home which can correlate with their lung function.
There are a few things which we can do regarding PFT per se. PFT has multiple values, which we call as
Yes.
FVC, FEV1, FEV1 by FVC. So in total, when we talk about the lung percentage, we talk about FEV1 and FVC. Then more than 80% usually reflects a good lung function. But it
Yes.
isn't as simple as that we can tell you 1% and it is more than that and you're totally fine. It doesn't
Yeah.
work that way. But there are a few other things as well, like we have peak flow meters, which are small devices which patients can buy, them cheap ones. It tells you your capacity, only the blowing capacity. And one value will be given 400, 500. So absolute value is not that significant. But significant thing is that if you have a value of 500 on a normal day, and you tend to have a fall in this value subsequently during the pollution days or the days in which you are coughing, that means there is some airway reactivity, there is some component of asthma. So these
Yeah.
are the tests which are there, which you can do to quantify your lung function.
Dr. Manu, I read somewhere that if you could do a breath holding of more than 40 seconds, it correlates good with your lung function. How true is that?
It all depends upon what kind of disease are we looking at. When we're talking about strict pathologies, yes, so
Yeah.
this might hold value. That you hold 40 seconds for prolonged periods, you might have lesser chances of having disease like post TB. You have the decreased lung capacity. You have ILD kind of a disease in which you're not able to hold the breath. But diseases like COPD and asthma tend to have more problem with exhalation rather
Yeah.
than holding until they are having exacerbation at that time. They're worsening at that time. Only during the worsening time, they might not be able to do this. Otherwise, asthmatics tend to have very normal lung function. So there are tests which can tell you that patient is not in exacerbation right now. They are not worsened right now, but they are not the exact test for lung function as such.
Right. So I think there's one more question. Uh, and again, these are all respiratory symptoms, so I think it will go back to you only. So, sir, while coughing, I usually get pain near my side of the stomach. Is it a sign to be concerned about?
Any pain is a sign to be concerned about, but the pain in the stomach can be because of excessive coughing because the muscles are used, they go into
Yes.
spasm, and then can cause pain. But any kind of pain which is there can be a sign of fluid in the lungs, which can happen on the left lower side as well. So yes, if
Yeah.
it is persistently there, not improving, we need an X-ray, we need to evaluate further.
Okay, very nice. I think there are these are the questions that were there. It has been a wonderful discussion. I'd like to take the closing remarks from Dr. Manu and then Dr. Ashutosh.
I think
Dr. Manu,
precaution is better than cure. I think
yes.
precaution is better than cure. Once you inhale those pollutants inside and you're not taking care of precautions, there is very less to offer when you develop a disease like lung cancer. Precaution is the foremost thing. And if you are at risk factor, you are a risk factor, like you are already a smoker, living in this polluted air, aged more than 50 or thereabouts, we can offer you lung cancer screening as a tool to look up as a possibility of early lung cancers, pick up the possibility of early lung cancers so that we can treat you early. As we have discussed previously, earlier you treat it, better chances that you can treat it through a surgery, which is a definitive thing, once and for all. The later you pick it, surgery is out. Then
Yes.
only you have the options of the radiotherapies, chemotherapies, the targeted therapy as Dr. Ashutosh talked about. So pick it up early, take your health seriously, and that is it.
Thank you, Dr. Manu. Dr. Ashutosh, your remarks, please.
Yeah, sure. As Dr. Manu said, and sir himself, that any persistent symptoms patient is having, he needs to get it checked up. And any weight loss and the persistent cough, blood in his sputum, as we discussed, all these things are very clear symptoms, and we need to look them as early as possible. People should go to the doctors. They should not be worry about biopsy as such, because it helps us in diagnosis. And if they are at higher risk, as we discussed, higher risk of getting cancer, they should definitely undergo screening to find out if they are having any early stage lung cancer, so we can help them in better way. So that is what my takeaway message is. So we should.
Thank you, Dr. Manu and Dr. Ashutosh. I think what I'll reiterate is, lung cancer is a really deadly disease, and air pollution, sort of adds over the risks that are already present and increases your risk of lung cancer. And one has to realize that nearly 1.8 million deaths happen every year because of lung cancer only, and that is more than the breast, colon, and prostate cancer combined. And if you look at the mathematics of it, nearly one death in every 17 to 20 seconds is happening globally because of the lung cancer. And that's a very, very deadly disease. And unfortunately, over the years that the lung cancer that we've been treating, what we have found that the only thing that affects the outcome is early detection. Because at early detection, our intention for treatment is to make the patient rid of the disease and make the cure the patient completely of the disease. So you can have a possibility of cure if the disease is detected early, particularly with now revolutionary techniques in minimal invasive surgery, where very with minimal cuts and robotic surgery, you can remove these early lesions with minimal morbidity and very good quality of life. In fact, even for those patients who are not, willing for surgery in the elderly age group, who are not too fit for surgery, there is stereotactic body radiation therapy which we can give and burn the cancer in the local therapy. But all this is possible only if the disease is localized to the lung. And then once the disease spreads out from the lung to the lymph nodes or other organs of the body, the survival rate decreases very dramatically. And there, despite our best efforts, although as Dr. Ashutosh has pointed out, there are several new techniques that are now available, which and several drugs that are available, which have really changed even the outlook of stage 4 cancer. Because 10 years back, stage 4 cancer would mean a death certificate, but today I can see a lot of stage 4 lung cancer patients coming to us with treatment even for 2, 3, 4 years. If I'm not wrong, Dr. Ashutosh, right? So if anybody in the family, close friends, or anybody is having persistent cough, if there is a blood in sputum, if there is an unintentional weight loss, if there is a focal chest pain that has been persisting, and there is new onset shortness of breath, which all these symptoms are, or any of these symptoms are persisting beyond 2 to 3 weeks, please get yourself evaluated by a doctor. Make sure that you try and protect yourself by all the methods that Dr. Manu had pointed out. So use a N95 mask wherever possible, judicious use of air purifiers to a selected group of patients, avoiding smoking, maintaining a good and healthy lifestyle and diet is all very important. And all of these patients who may be suffering from lung cancer, we have a good lung cancer screening and early detection program at Medanta Noida. And anybody who is there can, sort of avail these programs, which are available at many centers across the country. So on behalf of our panel, stay safe, monitor your AQI, and protect your lungs. Remember, early detection saves lives. Thank you very much for a patient listening.